Thank thank you so much. So I'm so sad that I cannot be here in person with you all today. I am at the American College of Lifestyle Medicine conference where I'm going to be taking a number of culinary medicine topics while here. But I wanted to introduce you because you've all been um, working with me, or I know what you're doing, and I want to support you so much. And I love what this team has put together. And I appreciate that Sravan Kakani agreed to do a grand rounds for me. And I knew it would be pretty interactive and cool. So I hope everyone who is in person really enjoys it a whole lot. Um, for those of you who don't know, Dr. Kakani is an attending psychiatrist and assistant professor at University of Vermont. But he's originally from Huntsville, Alabama, and pursued diverse interests during his education, including a Fulbright Award in South Korea, a research fellowship at NIH, and got his BS at Duke, and MD at Case Western, and psych residency at UCLA San Fernando program. But right now, what he's been really busy doing is being a consultant psychiatrist in primary care mental health integration, and joined the culinary medicine team in 2024, creating a program called Food and Mood. And he and his colleagues are now co-facilitating group medical appointments in the Seneca Mood and Anxiety Clinic. What a great added benefit. And he's hopeful that they expand to inpatient psychiatry. Also on the team is Chef Leah Pryor, who I've had the pleasure of working with for a number of years in a couple of different projects. She is the executive chef manager at Nutrition Services at University of Vermont Medical Center and began her culinary path in the 1990s and holds an AOS in culinary arts from Culinary Institute of America. Through her career, Leah has loved teaching, and she pioneered the chef educator role at UVMMC. And if you or at UVM Health, and if you've ever been to one of her courses or a program where she's teaching and exciting and gets everyone really stimulated. It's really fun. Students love her, faculty love her. I love working with her. And also Melissa Kelly, who I've had the pleasure working side by side with in Skills Before Pills. And she is also board certified in lifestyle medicine, registered dietitian. Uh, she is a member of the culinary medicine team and brings deep appreciation for interdisciplinary collaboration in healthcare. She is passionate about empowering individuals to live their healthiest lives by delivering evidence-based nutrition guidance and translating scientific principles into practical and sustainable habits. Rachel Boyer adds a whole other level to the culinary team with 10 years as a landscape architect. Um, then her path shifted following the birth of her son with some special health needs. And inspired by his joy in the garden, she supported families of children with disabilities and earned a certification in horticultural therapy from the New York Botanical Garden. Rachel is also passionate about building community and ensuring that the therapeutic benefits of gardening and nature are accessible to everyone. She holds a BS from Cornell University and an MLA from University of Pennsylvania in landscape architecture, and she joined the culinary medicine team in 2023. And with that, I'll let go and let you guys take over. I wish I could be there. I've heard so much about the food you might taste and the things you're going to do. I so appreciate your joining us for Grand Rounds. Thank you very much.
Well, good morning, and thank you, Whitney, for your virtual introduction from afar. My name again is Sravan Kakani, and I am joined by our culinary medicine team. This is actually our first grand rounds together, so we're very excited to keep the momentum going with food and mood. I will speak very briefly, and then we will get into an experiential activity, and then I'll come back to discuss some nuts and bolts of what we've been doing. Today's activity, today's hour together is really about inspiring you to think creatively about how to deliver healthcare using some of these modalities, specifically culinary medicine and group medical visits. We're very curious to know how you would foresee this happening or envision this happening in the settings that you work with the patients that you work with. We have created something I think very unique for the patients with mental health needs now at the Seneca program. And it's been very well received, and I'll share some of that journey with you. That everything has happened very recently. We only got to know each other just a couple of years ago and have built something pretty quickly. And so I don't have a lot of data to present about what we are talking about, but I can tell you about the process of how we got there, because I think it's a really good story in interdisciplinary collaboration. Let's see. So our learning objectives are to, one, participate in an experiential learning activity as a strategy for social connectedness. And so we'll move into that after one more slide, and two more slides actually. And then this is actually how we always start our group medical visits. So it's a nice way to arrive into a medical appointment. I will define culinary medicine for you and the programming that we have at UVM that any of you are welcome to participate in. And then we will hopefully help you to recognize the mental health benefits of group medical visits for not only patients, but also yourselves as providers. We don't have any financial disclosures. And so the mission of culinary medicine at UVM is to nourish health in our community through the joy of cooking, the science of nutrition, and the wonder of the natural world. And I think this is easier to show rather than tell. So we'll get into the experience in just a moment. These are some of the foundational principles of culinary medicine, and I hope that these come to life even today in this auditorium, that we are creating a safe space. We're developing common language to talk about food and health. We're going to share resources and support amongst each other. We're going to embark on an experiential learning opportunity to promote healing and mutually beneficial relationships. And hopefully you'll feel some awe and connection to what we eat and where it comes from, because those are vital experiences. So I'll turn it over to the rest of the team at this point.
Okay, can everybody hear me? Great, wonderful. Are you going to start?
Yes.
Perfect.
And can you hear me? So you started today actually with a little bit of what we kind of do sometimes. We're using a sort of a therapeutic horticulture activity as sort of an intro icebreaker, I guess you could say. So today you came in and I passed around the herbs. And so that's sometimes how we start. We ask people about, what herbs do you use? Do you know what these herbs are? Things like that. So that's one thing. There's a microgreen kit also, which is another activity that we've done. But today, since we're in kind of this audience speaker thing, I'm going to just lead you through a nature-based visualization meditation. So like we said, we typically start class this way, and this is the way we're going to start today. So I will invite you. I know you're all being given a golden milk drink. So just hold off on tasting that for the moment and just smell this fragrance of that. So right now, if I'm going to invite you to join me in this meditation, get comfortable in your seat, your feet on the ground, and just start focusing on your breath and breathing in and exhaling out, and being aware of your belly rising as you breathe in and as you breathe out. And as you breathe in, you're filling your lungs with air, and then as you breathe out, try to release tension down through your feet into the ground, which ends up in the earth, which is there to support and sustain us. And breathe in again and out. And if you're comfortable, you can close your eyes. If not, just look softly in front of you. So as you close your eyes, imagine yourself standing on a soft, earthy path in the middle of a peaceful forest. The trees around you are tall, their leaves gently rustling in the breeze. As you begin to walk along the path, feel the ground beneath your feet, cool and firm. The air smells fresh and clean, and you can hear birds singing high in the trees. As you walk, take your time to notice the green leaves, the patches of sunlight filtering through the branches, and the different shapes and colors of the plants around you. Soon you will hear the gentle sound of water flowing nearby. As you follow the path, you come to a small, clear stream. The water sparkles in the sunlight, and the sound of flowing water is calming. Find a comfortable spot near the stream and sit down. Slowly take off your shoes and socks, feeling the cool air on your feet. Now gently place your feet into the stream. The water feels cool and refreshing as it flows over your skin. As you sit with your feet in the stream, take a moment to notice and look around you. Notice the bright green moss growing on the rocks, the colorful wildflowers blooming nearby, and the different shades of brown in the tree bark. Listen to the birds singing their cheerful songs and the soft rustling of leaves in the breeze. The forest is full of life, and it's all around you, peaceful and calming. When you're ready, slowly take your feet out of the water and put your socks and shoes back on. As you stand up and start walking back along the path, remember the calm and peaceful feeling you had by the stream. Take a deep breath in, and as you breathe out, feel yourself grounded and relaxed, carrying this peaceful moment with you. Take another deep breath in and out. And with your next breath, come back into the room and open your eyes and exhale. Thank you. I hope you enjoyed that meditation. Sometimes doing a visualization like that and a nature-based one is a nice, accessible way for people to get into meditation. So we try to introduce people to a variety of experiences in culinary medicine. Now I'll turn it over to Chef Leah. Oh, yeah.
All right. You're going to have to stand close to me.
Do I need a microphone? Can you guys hear me if I just talk loudly?
Great. And maybe I don't need one then.
Yeah.
Oh, for online. I forget about the online. Good morning, everybody. Usually I have a lot more energy, but after Rachel kind of bringing us calmness on a Monday, I'm going to try to keep in that space. Thank you for that. So can I have some golden milk? Thank you. The chef always we get forgotten about. No, joking. So food and mood. It's funny, when we first started culinary medicine around, 13 years ago, it was nutrition and food, right? We were talking about the science of nutrition, and we were talking about the joy of food. And that was kind of how it all started. Then as the years moved on and we have these beautiful gardens, we started to bring in the awe of nature. And then all of a sudden, we started to see how this tool, culinary medicine, can really be for all types. And one of the things that we have found is the connection with mood, and how culinary medicine, or just the kind of act of sensing something together as a community, can really bring people together who might be feeling outside of that. So we have been so fortunate over the past year and a half to be able to take this to the next level. So just think about how that can connect us, and how, as practitioners, you can use this tool because it is here. And one little correction, I actually have a new title, which is I'm now the culinary medicine manager. So I'm now solely focused on culinary medicine through nutrition. So that's a really big deal that the hospital is making. They're saying, hey, this is important. This is a tool for our clinicians. So let's get out there and let's use it. So today what we're going to be doing is I had lovely, lovely Ashley and Betsy passing around some golden milk. Have you guys been holding it? Yeah, how's it feel?
Anybody want some more?
How's it feel in your hand? Warm. Right. So one of the things we like to do in every class is we like to do a sensory experience around food. And really, when we're looking at our foundational principles, one of the things that we focus on is actually how do we build language around food? And especially for the clinician, talking to your patients or your participants around food can come with some weight because all of us, whether good, bad, or indifferent, come with our beliefs around food because it is one of the things we all have to do. So when we do a guided experience around food, we really like to think about what it invokes within ourselves. What does it bring to you? What is your experience around food? And how can you help somebody find their optimal health? So it's not just us being like, oh yeah, the milk is gold. Great. That's fantastic. It is. But it's also creating a safe space for people to talk and to explore food. Because I'm going to tell you something, I've been doing this for a long time. We have lost our way a bit. And we need to create that space for our patients and participants to feel connected again and seen within this space. So what we're going to do is now that we've felt this beautiful little cup in our hand, I want us to take a look. What do we see? Please get esoteric. It's not just gold. What do we see? Anybody? What? I hear nobody? Yes.
It's actually a little foamy and it reminds me of the ocean, which I always find recharging, invigorating, life source.
Perfect. Foamy. That's exactly right. Like the ocean, bringing that back, recharging. What else? You guys can do it. Come on. It's Monday. I know. Spice. Also, yes. Mysterious. It is a little mysterious. You've been looking at it. I'm sure a little bit of saliva has started to pool in your mouth as you're looking at it. Again, reminding us that we are fully connected to food because we're actually having a biological response to it. I know that it's happening right now. So now it's mysterious. I like that. Now let's smell it. What do we smell? Does anybody want to name some of the ingredients that I've used in this? Turmeric. Cinnamon. What else? Ginger. Does anybody know what the base is for this one? It can be any base, remember. Oh, you can say it. Coconut milk. Good. Yes, coconut milk. Also star anise. There's a little bit of star anise in there as well. So those are all these very warming spices. And when we are infusing them into the fat, meaning the coconut milk, we're actually getting all of those wonderful, delicious spices mulling together to create this elixir. Now, that's from the culinary perspective. So from the science perspective, what does it bring? I'll come close to you.
Well, it brings our anti-inflammatory benefits. I'm sure we've all heard of turmeric as being an anti-inflammatory superhero. And does anybody know the specific compound in turmeric that's kind of known for its anti-inflammatory benefits? You just yell it out if you know. Starts with a C. It's curcumin. And curcumin is the very powerful component in it, and it's made more bioavailable by black pepper to our body. And so there's a ton of research on turmeric and its anti-inflammatory benefits. And then there's also ginger in here, and gingerol is the name of the compound in that one. It's a little bit easier, and it just helps modulate some of those anti-inflammatory pathways in our body. And we can go forward with this thing.
All right, so thinking about those two things, I think the culinary kind of benefit of this is remember fat is flavor. So when we are taking spices that are fat soluble, that is how we infuse and get everything that is available to us. So remember that. It's one of those things that I like to remind people that we need that to do for the curcumin and for the gingerol to kind of do its job. Okay, so now let's taste it. Because, man, I've been smelling it all day, all morning.
And I feel like a key component of food and mood and what we do with the mindful eating and the mindful tasting is I really like to highlight the connection between our gut and our brain. You know, our gut and our brain are connected through the vagus nerve. So eating in a relaxed state and taking that time to, you know, appreciate the food and smell it and really slow down, it makes those nutrients that are in the food more available to us. And I feel like that's a really key component and lesson that we go over in every food and mood class.
Because remember, all of us have a certain, you know, we have time burden, right? We have things, we're always rushing around, we're always doing the things. And sometimes we use this word mindfulness in a very large way that might feel like you have to find this finite piece of time to be mindful. But the funny thing is, if we can go through the world a step at a time by having the awe of nature, by looking and touching for just a brief moment to have something snap you out of the reality, it's mindfulness in its very kind of micro dosing way. So finding ways of just slowing down by just taking a sip of golden milk and tasting that. I mean, my goodness, how does that taste? Because I think it tastes pretty delicious. What do you guys think? Wonderful. Yeah. Yeah. What else? What comes to you guys before we hand this over to Dr. Kakani? Gratitude. Yeah, I think warmth in the hand, holding it, you can kind of feel it warming inside. Yes, gratitude. So thank you. All right.
All right. Well, thank you. And thanks everybody for participating in that. Before I kind of get into the specifics of our group medical visit, I just wanted to give you a timeline of how I even got interested in culinary medicine, because I thought if you're interested, you might find some of these resources to be relevant. So actually, I came to UVM in 2023, and prior to that, I had been previously working in Los Angeles. And so I became aware of culinary medicine through some colleagues, and I was just curious, what does that actually even mean? So I joined this organization, Health Meets Food, which is a way to get board certified in culinary medicine. But as I was going through the modules, I was wondering, what about the connection to mental health? There was a single module on depression, but I wanted to know more about how food and mental health can be thought about together. So that's when I came across the book, This Is Your Brain on Food, which I have on the table, and we reference it all the time in our group medical visits. This is written by a psychiatrist, Uma Naidu, who is a psychiatrist and also a chef. She works at Harvard, so she's also here in New England. And I think that book is written in a very accessible way in terms of the chapters are broken down by various categories of mental health. So there is a chapter on depression, there is a chapter on anxiety, which is what we focus on in the group medical visit. I will say that this is the copy at Dana. I asked them to purchase it, and I'll be returning it after this talk. So if you want it, you can check it out right after. So after coming to UVM in 2023, my chairman, Rob Althoff, encouraged me to join the Osher Center, and I see Kara's here. Thank you for coming, because that's how I could get connected to the other folks at UVM who are doing culinary medicine. And so through that, I came to know about various reading resources that Rachel highlighted for me, one of which is forest bathing. And I'm assuming many people have heard of this, or anybody who hasn't heard of this. This is a Japanese practice called Shinrin-yoku. This book by Dr. Ching Lee, who is in Japan, talks about the health benefits at a kind of molecular level, as well as on blood pressure, to be in nature. And I thought that this had a nice tie-in to kind of my move from a metropolitan area to Vermont. And what my draw was to Vermont was the forest and the natural beauty. And maybe subconsciously, it was helping me with my own mental health. And so we started talking a lot more as a team and decided let's apply for grants to try to make something come to life called Food and Mood. So we received grants from these two organizations, the Bi-State Primary Care Association and the UVM Medical Center Foundation grant. And in that time, I had also come across this book, The ABCs of Group Visits. And this is written by a psychologist who was a former engineer who had his own health issues. And then as he was trying to navigate the healthcare system, he was very frustrated with how inefficient it was and why he wasn't learning from other patients who were dealing with the same experiences as him. And what he was seeing was having to kind of repeat themselves over and over with each and every patient in an individual format versus just learning in a group format. So it's a very practical approach, and it was written, I think, in the early 2000s. And so it's not, as I said, this is not a new technology or intervention. And then this year, the APA, the American Psychiatric Association annual meeting, the theme was lifestyle psychiatry. And Uma Naidu, the physician I said who wrote this book, was there giving various talks. And actually, there was a whole workshop where she cooked with us in a kitchen. And so I was, again, just invigorated about how we can use culinary medicine in novel ways to work with patients and to work with providers to benefit everyone's health. Lastly, there are these two other organizations I came to know about, the Integrated Center for Group Medical Visits, actually through the Osher Center. That's another organization that's based here in New England. It's led by family medicine providers in Massachusetts. And it goes through just the nuts and bolts of how to run group medical visits and make it financially feasible for your organization. And lastly, the Teaching Kitchen Collaborative is a national organization as well that looks at how to get more culinary medicine education into medical schools as well as into the healthcare environment. All right, so the food and mood connection. Melissa briefly talked about the gut-brain axis, and I put a diagram here. I'm always looking for the most visually interesting and simple way of explaining this to patients, but also to providers. And I think at this point in time, there's been a lot that is now known about the gut-brain connection and that there is bidirectional signaling. And specifically, what we talk about a lot in our group medical visits is the gut microbiome and how important it is to feed that microbiome in a way that supports the health of the microbiome. So the microbiome in our guts is full of different organisms, a lot of bacteria that can break down the products of whatever we eat. So there's this idea of prebiotics and probiotics. They break down these foods that we eat or whatever we put into our bodies into various molecular components like neurotransmitters, so that can signal through the nervous system, as well as cytokines, which can signal through the inflammatory system, and various peptides that can signal through the endocrine system. So there is a lot of power in what we eat and how it influences our food. And the same goes in the other direction, that the kinds of inputs that we put in emotionally, the different stressors that we have, can affect the health of the gut microbiome. But like was already demonstrated, how you felt as you ate in a mindful way versus how you feel when you rush through. If you had to rush through a hot drink, I wonder how you would feel in that circumstance. So back in 2015, I highlighted this Lancet article, Lancet Psychiatry, that was kind of a call to action to put nutritional medicine at the mainstream or the forefront of psychiatry, because a lot of research was now coming online about this connection. And so one of the authors of this initial article in Lancet is based in Australia and conducted this randomized controlled trial called the SMILES trial. And it stands for Supporting Modification in Lifestyle in Lowered Emotional States. And it was a small trial that looked at people who are depressed and also not eating well based on different questionnaires on diet. And the intervention was over the course of 12 weeks to have dietary counseling around mindful eating and the different kinds of approaches to kind of a Mediterranean diet and the different principles of a Mediterranean diet. So healthy fats, more fiber, more vegetables, more fruit. and less red meat. And then the other arm of the trial was people receiving kind of a buddy. So they had someone that they could talk to about neutral topics or play games with. And they saw that at the end of this trial that the depression scores did go down significantly in the intervention arm, so the one that was receiving dietary advice. It was a small trial, so it was about 30 people in each arm. And so then the push was to do much bigger studies. And there are some meta-analyses here that did show reduction in depressive symptoms based on dietary interventions, and specifically the Mediterranean diet. I also want to highlight what we are doing with food and mood and kind of making the case for why to do it as a group medical visit because of the social connection aspect. I think that the power of this visit would be not as strong if we did it as an individual one-on-one patients interaction. I highlighted two studies here that I thought just were interesting. Well, the first is an observational study that's out of Wisconsin. There's a Wisconsin longitudinal study, and they have been collecting data on a cohort of patients for a number of years. And they do get fecal samples. And they saw that those who were actually married and how they defined the health of the marriage, like a very supportive marriage, actually had a much more diverse gut microbiome than those who were not married or who had felt more alone. And then there's this review article out of England at the association between loneliness, which is a subjective feeling of feeling isolated, or social isolation, which is the objective measure of how much actual social connection you have, and how that influences food and eating behaviors, and looking at how people were eating less fruits, less vegetables, and other types of dietary parameters when they felt more lonely or more socially isolated. And then, is anyone familiar with this report from Vivek Murthy, the former Surgeon General, about loneliness as an epidemic? So I see some hands raised, and I wanted to just highlight that if you look at the table of contents for Chapter 2, he is addressing the impact of social isolation on various mental health parameters. And that also that social connection can influence health through multiple pathways. And essentially that is the biopsychosocial model, which we always use in psychiatry. I excerpted a quote from the letter that opens this report that was written by Vivek Murthy. And it says, make time to share a meal, listen without the distraction of your phone, perform an act of service, express yourself authentically. The keys to human connection are simple, but extraordinarily powerful. And I really appreciate this because I think that is what has a lot of meaning in healthcare, and specifically our food and mood visits, is we're just getting back to the basics. We're literally eating together, and we're talking about food, which everyone needs to sustain themselves, and talking about it in a way that's non-judgmental and welcoming, and I think creative. We get a lot of conversation going in these medical appointments, and it's really nice to see and to learn from each other, and to see that patients are sharing with each other what strategies work for them and what don't necessarily work. So what does our group medical visit look like very specifically? A group medical visit at its core is also called a shared medical appointment. So I'm using these abbreviations interchangeably. And it's multiple patients receiving care at the same time. So that can be in person or in a virtual format. We right now are only doing things in person, not a hybrid model. And then there's management and treatment of a shared medical condition. And so in our group medical visit, this is depression and anxiety. There's a licensed clinician who's billing and documenting the visit. So that would be me. And I also have another psychiatry colleague at Seneca who is also doing some of these visits. And then there is patient interaction that's happening with the provider. It's not just me talking in a didactic way. There is that component, but we do check in with each individual patient multiple times during the visit. This is a picture of our setup. You can see that we have a lot of different place settings, I guess you could say, for each of the patients. We've been able to accommodate up to 15 people. And you'll see there's a number of different handouts, which I will talk a little bit more specifically about, and that there is always an experiential activity. So you can see that at the central table, which is draped in this green cloth, that's where Leah and Melissa set up the food demonstration. And then at each table setting, Rachel has put out the different components of what we do with nature. And so there is some herbs there. And in this case, this is for making an eye mask. And there's flax seeds. There's also a scissor at the table. That's not usually what we have. We don't have scissors or knives. We don't actually cook together in the appointment. That was just there, and it made its way into the picture, but it wasn't there at the actual appointment. All right, so what does our group medical visit look like logistically? So we have learned that 90 minutes is kind of the sweet spot for how much time to spend in a group visit with the different patients. And we divide it into thirds. So the first third is a nature engagement activity, or arrival activity, kind of like what you did today. Sometimes it's much more hands-on and people are kind of making things. Like I showed with that the eye mask. I then will open the visit with staff introductions. So we have all of our interdisciplinary staff at Seneca. We also have a therapist who's helping us with recruitment and kind of just the nuts and bolts of running a group medical visit. And then I'll go through a nutritional psychiatry concept. And so that's kind of the gut-brain axis, or the gut-brain axis, or the benefits of omega-3 on inflammation, or brain-derived neurotrophic growth factors, so BDNF. These are some of the topics that we try to highlight and how it connects to the food that we're eating. We try to have a centralized theme, which I'll show you in the next slide. So then we move into what Melissa and Leah kind of demonstrated in a fuller format. They do a food demonstration. There's usually a whole recipe that Leah has created based on the principles of this book, and talks about each of the ingredients. And we can pass around those ingredients and kind of, again, have a sensory experience around that. And then Melissa will connect the dietary principles and nutrition concepts, again, to mental health, but also to physical health. And then we end with a mindful eating exercise of that specific dish. I'll say that people are so engaged at this point. You never see anybody on their phones. Everyone is like taking notes, and they're asking questions. And Leah gives out great tips on the kitchen and how to work with food. And she didn't share it today, but to freeze your turmeric and to freeze your ginger. I'd never even worked with whole turmeric, and I'm Indian, and I learned that tip from Leah, and I cannot tell you, countless other people have given me feedback, like they've changed their practices in the kitchen or at home with different ingredients that they had been working with forever or had never even been exposed to, because they simply did it together in a visit, and it kind of gave that kind of encouragement. So the last part is the individual goal setting, and I'll show you what our handout looks like. But we do try to focus on 3 different areas for goal setting, which is nature engagement, mindful eating, and social connection. So all of that is happening in the visit. So I like to joke that we are microdosing on these experiences in the session, and people then patients are able to kind of reflect on what they have experienced in the session to figure out how to behaviorally activate going out of the session, and to do this on their own or to do this with other people in their own lives. So what does the documentation look like? I know documentation always feels very burdensome. You can see here that I put in gray this box. There is a templated, smart phrase, I guess that's what it's called, in Epic, that I can populate everybody's note with. And then there's this middle section that is unique to each individual patient. And you can see where the individual check-in populates the HPI. The nutritional psychiatry concept comes into the counseling and education provided, and then there's the individual goal setting, populates the assessment and plan. By populate, I mean, I do have to type this in myself, but there is a group note function. Is anyone using group notes that's doing group? So there is a group note function in Epic that makes it very much easier. You don't have to click and open each and every person's chart. You can just quickly jump from person to person. It's kind of fun, actually, the way that they've created it. It's colorful, and it does make the documentation burden a lot less. So for 10 patients, I can document in about 30 minutes. All right, so this is some examples of what we do in the session. So what we've decided to do at Seneca is create a 3-session series. And so we do that in consecutive weeks, and we've come up with different themes that you can see here at the top. So 1, 2, and 3 is building community, and then soothing stress in 2 different parts. And so then we try to highlight how that connects to your mental health, and the gut-brain connection. And again, we're always referencing the principles from this book. So the blue section highlights the different kinds of activities that Rachel brings from a therapeutic horticultural standpoint. And we can mix and match these and make them seasonally relevant. So I think that's another way that this class, that even if you've gone through it once, if you come back to it, you did it in the fall and you come back to it in the spring, you're going to have a slightly different experience, but it's going to reinforce the same concepts. And then in green are the culinary arts portion. So all of these recipes are recipes that Leah created based on the principles from this book. And if you read this book, every chapter ends in foods to embrace and foods to avoid. So we always are trying to think about foods to embrace. We're not telling people stop doing a certain thing. We're trying to just encourage a gradual shift towards other ways of being healthy for our minds. And again, these can be kind of adjusted seasonally. And then we end with the integrative health and wellness coaching kind of modality or format, to encouraging people and encouraging patients to think about how to engage with nature in the week going forward, how to mindfully eat, or how to socially connect. And we get great ideas from patients who they share this out loud. And then there's a lot of crosstalk about, okay, here's a suggestion of what to do to make it accessible to you. Like if somebody says, I'm going to go out and walk in nature, well, where's this very specific place? So we really tried to come up with SMART goals, specific, measurable, is it actionable? Relevant and time required. Attainable? Yeah. All right, and these are the handouts that we utilize. So again, I tried to kind of color coordinate them with the activities I just showed in the class. So Rachel always has a handout, and there is a handout, I believe, up here that you've created for today. So this one is highlighting the touch and smell herb activity. Then there is always a recipe card, and there are recipe cards here. So we do invite you to come and take one at the end of this that Leah and the culinary medicine team have created. These all live online on the UVM Culinary Medicine website. And that QR code on the recipe cards gets you to that web location. And then the health behavior goal setting is here in pink. So what does this look like from a billing standpoint? Because I'm a psychiatrist and giving care in Seneca, patients are already kind of associated with Seneca. So by seeing me, it's considered a follow-up visit. And I can use time-based billing, these codes 99213 versus 99214. I asked the billing experts on, what's the average reimbursement that we are getting. And so I've just made a table of what the average Vermont payer would pay for a 99213 versus a 99214. The goal of a group visit is to max pack the group visit. So that's what this psychologist whose book I referenced earlier, the way to make this financially feasible is you need to have a full group. And that's also the way to make the group function really well as an experience, is to have it be full. So you can see that we are aiming for 10 patients, and that gets about $900 of reimbursement. On the back end, that revenue is shared with nutrition services because I am the only billing provider, though I know Melissa is able to bill as a dietitian. With the psychiatry billing is more profitable, so that's how we can then share the billing together. And so that's been worked out at the departmental level. So what are some of the benefits? I've listed a lot of them here, and there's likely more than these. I'll just highlight that you get more time with patients. A lot of patients comment to us afterwards, like it's so unique to be able to be in a room with 4 different experts who can kind of talk about the same topic from their different disciplines, and it's very invigorating and encouraging. That they didn't have to go to 4 separate appointments necessarily, or 4 different experiences to get that information. From our standpoint, this is very team-based. It's very collaborative. We work together well across disciplines. I think it's different than what I would be doing specifically in psychiatry one-on-one appointments. It's not necessarily experiential when I am one-on-one with patients, but here in this setting, it's very interactive, which I think keeps people engaged and interested. The setup is mobile, so Leah is able to bring this magical cart of hers that has all of her ingredients and supplies, and we can set up anywhere, so that we don't need access to a kitchen per se. Let's see, what else do I want to highlight here? The Integrated Center for Group Medical Visits, one of the family medicine providers there is really wants to study the impact on providers, not just patients. And she comments on that there is an enhanced meaning and purpose for clinicians, which hopefully would reduce provider burnout and improve retention. And I think the most important part is that it's fun to deliver healthcare in this way. That you get the power of the group and the group of us, but the group of patients and then us all together is really dynamic. This is a timeline of just how we've been working together. I wanted to quickly just share that this has been very short period of time. Fall of 2024, so just last year is when we were piloting this as a single session in the community. And then we got the grant and then made this into a community series on a monthly basis in the spring of this year. We were initially doing a 60-minute visit and we just realized that's not enough time. So that's how we extended to 90-minute format and decided and found partnership with Seneca to kind of host this as a group medical visit. So this is the first time they've been doing this. So it's been a nice collaboration there. I would say the benefit of doing it within Seneca is that the patients there already are accustomed to being part of groups, and they already have the scheduling staff. They have a therapist who's really aligned with this philosophy of culinary medicine for mental health and has been able to recruit for us. And they have the space for a group visit. So I think all of that has made it really successful at Seneca. We did our first series in August, and now we're actually completing our our second series this month, and it's actually this afternoon. Because of all of the enthusiasm around culinary medicine and as people are learning about it, everybody wants more. So inpatient psychiatry is now really eager to have us. And so there is plans for a monthly group on both wards of the inpatient floors starting into the new year. I'll say that the strengths that we have at UVM are that we get along quite well as a team. And I think that really has helped us to function and so efficiently and speedily to get to where we are today. We have great departmental support. I in psychiatry and nutrition services, their leader is actually here. And so I think it's great to have that kind of encouragement at the departmental level. I'll say that the Seneca program has been a great collaborator with us, especially in providing all the kind of administrative support around scheduling and just the space. And then the fact that we can share revenue with across disciplines is really, I think, that's necessary to keep this going. We had seed funding, so we're thankful to our supporters there. And then that we're also thankful for the fact that we were able to do this as a community pilot, not only here in Chittenden County, but also in Washington County. And we found different, we just did this at a library. And we had such an enthusiastic group of people who found out about us through Front Porch Forum and brought all of their friends. And they were like, can you please come back more and do more of this and bring it to the whole state? So what opportunities exist at UVM? These are the final 2 slides, I believe. So for you all, I just want to make you aware that if you are at all enthused after today's grand rounds, we do have 2 gardens that Rachel oversees. One is here at the medical center, and then one is at Fanny Allen. They're open to the public. They have been put to bed, I think, for the season, but they are very robust and great places to just experience nature in the spring, summertime, and fall. And like I said, all of our recipes are online, and I've linked that here. As far as for patients, there's a lot of different programs that already happen. I want to highlight that Whitney is leading Skills Before Pills within family medicine. And that coming in 2026, like I said, is inpatient psychiatry collaboration, but also one with oncology, Gardening for Health. So if you are looking for very specific ways to get involved or to just have your own journey into culinary medicine, I've listed a lot of the different resources that I referenced earlier. You can explore those on your own. And I just wanted to highlight the last one, which is consider signing up for the 20-week Learning Garden program. So Rachel leads this program starting in May, and it goes into September, and it's each week. So it's intensive, but it's intended for kind of people who are new to gardening. You get a whole garden box at the Fanny Allen campus. Has anyone done this program? Oh, okay. And you learn all techniques and tips and tricks for growing your own food. And you kind of get to choose your own adventure. You choose what you want to put in your box. And I think something that came to life last year is that the boxes started to be shared amongst people. So you could even think about having a family medicine department box. Oh, yes. It's co-taught with dietitian, chef, and garden education. All right, so that's it. I thank you all for having us, and I think we have a couple of minutes for interactive questions.
Thank you for this great lecture. But I am reminded of how kind of funny the Harvard allopathic medicine is in this lecture. I know that Denver Children's 20 years ago set up a multidisciplinary psychiatry, nutrition, and probably some other stakeholders program where they were meeting with children, reviewing diet, changing diet, providing the resources to change the diet, and had reversal of diagnoses such as oppositional defiant disorder, ADHD, all these other things that are naturally housed both in psychiatry and family medicine, but also through other avenues. So it's great to hear that we've deployed this. Do you have plans or hopes to broaden the scope so that we can better further tackle other things in a cost-effective, healthful, salubrious way?
I guess the short answer is yes, but I'm looking for collaboration amongst other disciplines. We do have interest in child psychiatry, specific to your question or your statement about what Denver Children's was doing decades ago. There is interest within child psychiatry to get this kind of programming going. I don't know what billing looks like when it's done in a family context, but I don't think that is something that's prohibitive. We have expertise now with some of the organizations I shared. They are family medicine providers who are leading that group medical visit organization. So I know that it just requires creativity and interest, and it can be figured out. And go ahead, Leah.
And we also have the Kaleidoscope program, which is a needs-focused shared medical appointment that Allison Report leads.
Thank you. This is fun. I'm still enjoying that mysterious taste. It's wonderful. With respect to end-of-life care, the spiritual well-being of engaging in food and ritual and taste and people, have you done anything? around thinking about the culinary opportunities for kind of low volume with tastes and experiences with differential impact on stimulating nausea or gut type of response, for people who, who might be able to participate but would need different sorts of things.
That like would make my brain and all sorts of things. Definitely want to connect with. All right. So right now we're kind of at a precipice here in culinary medicine with what we can start to offer. We're trying to connect with as many departments as possible in spiritual care and kind of using our garden spaces and trying to figure out ways we can support. That's what we're here to do. So things of that nature, to look at that and to start to explore, would be something right up our alley. We're always, we've been doing this in a very small and clever way, infiltrating into everything since 2012. So we're ready to collaborate in any which way possible. So reach out. Yep. Connected to the PAC team. Yep.
Pediatric advanced care team.
Oh, totally.
So we connected with them. Yes.
Yeah. Great.
So I'm Allison Precourt, and I run the pediatric end of exactly what you talked about, a 4-week Zoom program for tweens and teens. I do have a billing question. So I run the program with a psychology student at UVM. He's in a doctoral program, but I'm the one that does the billing. I bill for group nutrition medical visits. Now, in your billing model, you're billing as a provider, but nutrition isn't billing as well. Can you only bill one specialty?
Yeah, I believe you can only build one specialty per visit. And so that's how we've decided to bill at the highest reimbursement to make it cost effective.
Allison, can I ask hi, Laura, can we refer patients to your program, adolescents and tweens? And what are you guys doing?
Okay, so yes, you can refer to the program. You would refer under for pediatric nutrition and under pediatric nutrition under Kaleidoscope. I run the program actually through GI. Dr. Mike D'Amico and myself have we have a clinic called Healthy Living Clinic, and this was an offshoot of that program. So anybody can be referred. We need a nutrition diagnosis, so it was created for weight control, high BMI, but also for elevated lipids, type 1, type 2 diabetes, elevated liver enzymes, prediabetes. So a nutrition-related diagnosis kind of gets you into the program, but you don't necessarily have to be one of my patients. I can send you flyers because I do have flyers. Our next program is winter sometime. We haven't quite figured out the dates, but they're run Wednesday evenings from 5 to 6:30. 90 minutes we found was a sweet spot for the program. And each week is a different cooking program with psychoeducation wrapped in that 60 to 90 minute period.
Excellent. We're having interdisciplinary collaboration happening in real time. Any other questions?
I have a couple on Zoom. How does a patient get into a group?
So right now for our food and mood group, you have to be enrolled in the Seneca program. So patients are already engaged in Seneca's offerings, and this is an additional offering. That's the way we've had to structure it, at least as initially, to make it something to start with.
And can you speak to the health equity and justice component for our patients with significant food insecurity and in general other SDOH concerns, and how we might expand to these populations?
Yeah, I think the social determinants of health is a really important aspect to address. I think we don't necessarily do it in a instructive or didactic way, but maybe more of an experiential way. We do highlight challenges and successes. We ask patients to we invite them to share those kinds of experiences they've been having. And then we may workshop that together in terms of what kinds of resources exist. And I know Leah wants to say something. We also do give out ingredients that are part of the recipes. So, for example, we might give out turmeric or ginger or chia seed to kind of encourage people to at least try out some of these recipes and not just assume that everybody has access to the ingredients.
So from that perspective, so there's a few things. First, all of our when we think of building recipes and things of that nature, we always think of access from the beginning. That's very important, especially when it comes around food. Culinary medicine is not a food security intervention. It is a tool that can be used to get people to think about food in different ways. Sometimes we put them together. But what we're doing, we just received a CDC grant through the state, which is around diabetes education, but there will be a very large component around food insecurity and how access to food, of course, really, informs social determinants of health. So the other thing is that we're also working on centralizing our food shelf here within the hospital. Looking at it from an outpatient versus inpatient kind of methods that we can really start to at least get food to people who need it to get them to the next intervention. This is my soapbox, but we have a hard time feeding the state of Vermont. And that's pretty wild to think about when you think about the food culture that exists here. So we're really trying to look at many different ways that we can continue to have access and using culinary medicine to drive that. So thank you for that question. It's a good one.
Well, I know we're at 9:00, so I want to be mindful of everyone's time. But thank you again for listening and coming today.